You can also go on our website, which is county.milwaukee.gov, which will also have the most updated information on the cases, any facility closures, any impacts on services, and things like that. As of yesterday, Milwaukee County opened the Emergency Operations Center, and I am going to be the manager of the EOC and also serving as the Chief of Staff to the County Executive. We're here today because we want to tell you about what this EOC is and why we think this is an important step to take at this point. We have a really great team working on this around the clock. Some of them are here behind me, and a lot of them are in their offices or at home teleworking to get everything under control. So I want to introduce the first person to speak, which is Dr. Weston. He is our medical director for the county, and he'll give you an update on the number of cases we have and any other developments.
Thank you. Good afternoon. For a brief situational update, we currently have 13 cases in Milwaukee County. We have about 180 cases that are under investigation that we continue to follow very closely. The Office of Emergency Management through Milwaukee County is working on developing a map that will be public-facing that will help the public and our health systems and partners to get a better idea of the current situation in Milwaukee County, to show generally where these cases are. It will help both for a public understanding as well as better resource allocation throughout our community. We are also working with all the health systems, the federally qualified health centers, the Milwaukee Healthcare Partnership, as well as all of the health departments throughout the county, and all 15 fire departments working very closely together as we continue to develop plans and operations to ensure that our providers are protected and that all the citizens and visitors of our county are cared for in as high a level as we are used to. And we look forward to continuing to work together. One last note, it's always worth reminding, the 911 system is invaluable to our community. 911 is for emergencies only, so please only call 911 for true emergencies. Thank you very much. I'd like to introduce our County Executive, Chris Abele.
Thanks, Ben. So you've obviously heard all of us talking about coronavirus and what it means quite a lot, and you're going to hear a lot more. And the reason that you're going to hear a lot more is this is by far and away the single biggest challenge that this community and arguably the state has faced in probably half a century. It's really easy to read the news and see numbers, and it sounds like an abstraction. But just to be clear, a good friend of both of ours, the mayor and I, made the analogy that you've got a state with a population of about 6 million people. If Wisconsin had a phenomenally good and just ideal response, minimized the amount of infections, and kept it at 5%, that's 300,000 people. 300,000 people, and that is an incredibly rosy number. If it's 10%, which is still a fairly rosy assumption, if only 10% of the population of Wisconsin contracted coronavirus, that is the entire population of the city of Milwaukee. So when I say we're facing something serious, we are facing something serious. And the reason that you're seeing all of us here today, and we've all been talking with each other in our departments probably as much as we ever have, and that's going to continue, is because we have to. You've heard people talk about social distancing, and you've heard about washing your hands. There's one way and one alone that pandemics end, and that is essentially people who isolate from each other. If we do that well, we have a hope to minimize the impact on this community. But every person watching this right now should be very clear. The degree to which we are disciplined in following this advice is the number of lives lost or lives saved. Lives matter. And if you're young and you're healthy and you're thinking, hey, I feel great and I'm reading that I'm not statistically a risk, well, the people you interact with are. And every single time you keep interacting with people, you increase the number again and again and again, of which you need just one to have the virus, and then you can pass it on to other people who are a lot more vulnerable. This is a very, very serious issue. The good news, though, is you've got really active and committed public servants who are working together, and I couldn't be prouder to work with all of us. And from the state on down, the level of coordination has only increased. And I want to thank my staff for working round the clock over the weekend to stand up what you heard about, an Emergency Operations Center, which is essentially an entirely new department. But that's how important this issue is. So you'll be hearing regularly from us on updates. We want to compile and disseminate one source, the best data we've got. When you heard about Dr. Weston talking about a map we're working on, a digital map that would basically update sort of by location, you can see where the cases, where's the growth, what's the spread, and data from those. The more data we have, the better we're able to respond to all of this. But importantly today, we're setting up a coordinated operations center, emergency operations center, which involves all the municipalities, the county. We're all in this together. We've got daily calls today we had probably 250 people, and it's, superintendents, it's school districts, it's universities, everybody is working together, and that's got to pick up. But if there's one takeaway on what does this all mean for me, it means it's serious. It means it's not like bad weather story. It's not like they canceled, my favorite basketball team season. This is about the potential to lose as many lives as this state has lost to any disease in over half a century, and that's real, and that's why we're all here. So with that, I will turn it over to my friend, Mayor Tom Barrett.
Thank you, County Executive, and thank you very much. As the County Executive said, there's been a tremendous amount of cooperation through all government on this issue. And I want to echo his statements. I think that this is the most serious challenge that this world has faced since World War II. In terms of the challenges that we have before us. You see it in Europe right now, we saw it in Asia, we're seeing it come to the United States. And all you have to do, tragically, is look at the map that we have here in the United States. Stay at home. Be isolated. That's what the message is. Please stay at home. There are going to be changes in our society, hopefully for the short term, but we as a country, we as a community, we have to tackle this in the most serious fashion possible. Thank you.
Good evening. Thank you, Mayor Barrett. Thank you, County Executive Abley, Dr. Weston, and our team here today. As you know, again, we're continuing to provide regular updates on COVID-19, also known as novel coronavirus. As Dr. Weston noted, the number of cases in the county, in the city of Milwaukee, there are now 9 cases. And we have determined that based off of our latest information that we are seeing community transmission or spread at this point in time. What that means is someone is a case or they were exposed to someone, we don't know what the source is. So they weren't a traveler, they weren't directly exposed to a case. So when we do the contact tracing or whatnot, this is what we're learning here. So that means we need to take more aggressive action. I'm aware that Governor Evers issued some orders or updates today based off of the CDC guidance about limiting events of over 50 people for the next 8 weeks. But today the White House issued an updated order or guidance of 10 people for the next 15 days. So we will be issuing a blanket order for the city of Milwaukee, and I know that the mayors are meeting after this to discuss a county-wide order. So I won't give the details yet because they need to meet after this, and then we plan to provide an update after the fact. Again, we have to take aggressive action to prevent this disease from causing unnecessary deaths and illnesses in our community. Either way you put it, there's going to be an economic impact, whether people are ill and out of work or unable to staff businesses, individuals that are racking up medical bills because they are very sick and they have to be admitted to the hospital. So whatever we can do as public health professionals, we're ready and willing to do that right now. Another point to just remind you what this is, the symptoms of COVID-19 are flu-like, fever of 100.4 degrees Fahrenheit cough, and respiratory distress, including shortness of breath. Those that are most at risk are individuals over the age of 60 and individuals with underlying health conditions, including blood disorders, chronic kidney disease, lung disease, immunocompromised individuals, including those that are undergoing cancer treatment or therapies, anyone that's pregnant or was recently pregnant, endocrine disorders, heart disease, lung disease, and neurologic conditions. Again, these individuals are most at risk. We also want to remind everyone that the county and the city of Milwaukee has declared racism as a public health issue. So COVID-19 is not race related. We are all subject to contracting this disease if we don't do something about it. So again, we want to remind everyone to treat each other with respect, but yet keep your distance. 6 feet is what we're promoting, and also exercising good hygiene, good hand hygiene, washing your hands for at least 20 seconds with soap and water, using alcohol sanitizer if soap and water is not available that has 60%. And then if you're ill, not coming into work or to school or church or whatever. And then also not touching your face, which is extremely hard once you say don't touch your face. So that's all we have. Now I will turn it over to Christine Westrich, who is the Director of the Office of Emergency Management at the county.
Thank you, Jeanette. Thank you. Good evening. My name is Christine Westrich. I'm the Director of Emergency Management for Milwaukee County. And yesterday we did launch the Emergency Operations Center for Milwaukee County. And when we say we're launching an EOC, which is the acronym for Emergency Operations Center, it's not an alarmist maneuver. Rather, this is a way for us to bring order to government. It's a way to communicate and organize all the various complexities, the elements and functions of our government that serves all of you. So we try to bring order to disorder. Have confidence that the people that are populating our EOC are the best and brightest in county government. We have 3 functions primarily that we're working on, and that's getting real-time information and communicating that to our first responders while also protecting our first responders. Secondly, we're really focused on a coordinated response, and that's really with our local health departments. So as Milwaukee County, we are serving to coordinate amongst each municipality, each jurisdiction that comprises our county here on the shores of Lake Michigan. And then lastly, what we're having today here is a public information experience where we're sharing with you everything that we're doing so that you can have the confidence that your government is serving you correctly. And with that, I'll turn it over to Riza Colton, the Chief of Staff. Thank you.
Thank you all. To close, I'm just going to run through a few county updates so you have the most recent information. Again, this is all on the county website, county.milwaukee.gov, and this will be updated daily for any closures or interruptions in service. So first of all, the county is urging all employees to work remotely where possible. We're prioritizing those employees who cannot work remotely and making sure they can still work safely. The Department on Aging is recommending older adults call the Aging Resource Center instead of come physically to the center.